Hi, I'm Dr. Faranak Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between.
Hello, we are back, and I'm very excited for a guest today, Dr. Garrett Coman, who is a board-certified dermatologist at the Department of Dermatology at St. Luke's in Idaho. And I loved a recent conversation that I had with Dr. Coman, and I thought it would be pertinent to have it on the podcast. So Dr. Coman was giving a talk on applications of AI in dermatology, and one of our mutual friends saw that he was speaking on DermGPT and connected us. What happened is we started talking about his clinic, and I realized how high volume what he's doing is, which is not different from what many dermatologists are doing. So I thought that in itself, a conversation of just how, because people are like, well, why are dermatologists tired? Don't they just sit around and do Botox? But the majority of us, we do some of that too, but we have just these really high volume practices. So Dr. Coman, thank you so much for joining today.
Happy to be here.
That's great. And you've done so much in the past. You have a background even in economics and lots of medical device innovation, lots in clinical trials. You speak so much on AI now. So I'd love to hear about all of that. But if you wanted to start, do you want to give us kind of an idea of what your everyday looks like? I know you're just you're in medical, general medical, but you're doing everything, right? Surgical, pediatric. But yeah, give us kind of a view into your day.
Great. Happy to. So yeah, typically, I'm general dermatology in the very, traditional sense. I see, newborns all the way through geriatrics, and we do medical derm, surgical derm. I recently got my Mohs micrographic surgery board certification. And so starting to do a little bit or continuing to do a little bit of Mohs. But I think on a typical general dermatology day, typically 32 to 34 patients. That's probably about 40% to up to 50% skin checks, and then the rest being more medical derm. We schedule our clinic, I think we schedule many, many months out for our skin checks, and I'm really intentional about leaving same-day dermatology or urgent dermatology appointments at the end of each day, as well as referral slots. I really want the primary care providers in the Valley to be able to get patients in a timely manner. Hopefully within the week, at the very longest 2 weeks. If they think that a patient needs to see a dermatologist, we want to be available for them. And then we also have a couple spots at the end of every day that are same-day dermatology appointments. Those are for acute rashes. Patients don't need a referral, but if they call the front desk and say, I have a rash that is new, we can get them in the same day to see them. And so that brings a lot of interest to my clinic and my practice to just be able to continue to see urgent acute dermatology visits. I think provides a lot of help for our primary care providers in the Valley. Then a couple times a week in the mornings, I kind of block off for surgical dermatology to do many ED&Cs and excisions, and then a few Mohs cases. Don't do really any cosmetics. We luckily have a local dermatologist who is interested in cosmetics, and so I send the cosmetic patients her way.
Oh, that's great. Yeah, thank you so much for reading that. And I think the interesting thing there is, of course, you just have it so down, and you're describing it in a very relaxed manner. But I think the important thing there is that's a really really busy day, right? That's so 32, 34 plus patients. You're adding on acute rashes at the end of the day, and I think any board certified dermatologist understands how much time is involved in the workup of taking that on. But it's so incredible having that access, for the community, the way you set it up. And then I presume, because most dermatologists with a day like that, up to eight plus hours of patient facing, you probably have a good 4 or 5 plus hours EMR facing time, right? Afterwards, is your breakdown kind of similar to that?
Yeah, great question. And the answer is that it definitely used to be. That would be like the average. And that really like wasn't sustainable at all.
Right.
Um, just there aren't enough hours in the day, and then you end up using, your weekend days to catch up instead of relax and restore. And so we have structured our clinic, and I feel very fortunate because we've had an institution that has been supportive, but we have really great support staff to help with our Epic inbox, which is a whole nother um, time suck, but also, really important and helpful tool for our patients. So we want to be available. And then also for scribing in the room. So we use a combination of our MA staff, nursing staff, and AI, Ambience AI, to help with scribing in the room. And it's really all of the support that I have that makes it so on most days, I would say 60, or if I'm being honest, probably closer to 90 minutes of closing charts, um, calling the patients back that the nurses triage to my pool, and kind of wrapping things up before I'm able to go home at night.
That's incredible. I mean, even that though is a super long day. So I think it's just important to understand, like for large healthcare systems, the burden of the dermatologist, because 30 to 34 visits is not normal in any other field. I mean, we classically hear about primary care being overburdened, and they are for sure, and they have lots of messages coming their way too. But they easily will see be half or less than half of that volume, longer visits, which generates less outside work too. So I think one important takeaway there is I think all systems just need to realize that dermatologists need resources to be able to do these types of volumes because we still have months of wait. But I love that you've decreased that average 4 to 5 hours that every other derm is spending for that level of patient facing time to about 90 hours. That's huge. So I'd love to get a drill down on that if that's okay. So I'm guessing you have a lot of inbox messages that come in, and you mentioned that you have some staff help with that. I'd love to kind of drill into that because I've seen two different groups. Some groups are doing this and doing it really well. Others, the staff is just forwarding it right to the doctor. So it's not necessarily, it doesn't decrease how much you do. Like what things have you guys done in your training, or are you using AI there, or is it just staff? If it's staff, is it nurses, MAs? Like how have you worked that where you decrease your touch points with the messages?
That's a great question, and it was not something that we necessarily had a manual on how to do. We've kind of figured it out on as we've gone along here. I think at the beginning, I tried to do it myself, and it was just a setup for failure because I would put this pressure on myself to respond to all of these patients. But like you said, you see 34 patients a day. You're done seeing patients. You spend a couple hours signing your notes, and then you're just like, it's already 8 o'clock at night. And then you go to your inbox and you've got 15 plus patient messages. And what I quickly realized was just like, I didn't have the bandwidth to do it. And they were being neglected. They weren't being replied to in a timely manner. And we were also like getting some crazy messages from patients that should be not be coming to dermatology, like, oh, I started putting on 5-fluorouracil, and all of a sudden I've got really bad chest pain and shortness of breath. I'm like, okay, that's probably not your fluorouracil. It's probably you're having a heart attack. You need to go to the emergency room. And patients you know are waiting for our reply. And so I guess what I'm trying to get at is I really felt like they needed to be addressed quicker than I could address them. And so the change that I made from the from pretty early was like, we created a pool within Epic, and all of my patient messages go to my pool. And then I have the most experienced nurses, and then a couple very experienced MAs in dermatology who go through those and respond to all of the messages that they feel comfortable responding to. And then the next point that you had was very insightful, where some people just forward it to the doctor. And so we tried that for a while, and that didn't really work either, because then I'm still neglecting the most important ones, right? The ones that they have identified that need my help. And they're sending it to my inbox that by the end of the day is dozens deep, right? From pathology reports, blood work, messages from primary care. I mean, it just gets lost in my inbox. So then what we implemented was, I really had the nurses take ownership of the inbox and said, if you have a message that you need input on, I want you to grab me between patients, and we go into Epic. If there's photos I need to look at, like maybe somebody's on day, 12 of their Effudex treatment and they think that they want to stop early, so they sent us a photo. They give me the MRN, I pull it up, I look at the photo, and then I tell the nurse what my clinical and medical decision-making is. And then the nurse is responsible for replying to that patient. So I am almost never sending messages to patients. It's all coming from the staff. But when it requires MD level decision-making, they are coming to me and sitting there next to me and asking me for that medical decision making that they need, but they're still taking ownership of the communication.
That's great. I love that workflow, and it sounds like you have a great staff too, which is also part of the training you've done with your staff. So that's so key, just to set things up for success rather than failure, because we know we're not getting things to things till 6 p.m. And I love that you framed it around actually just accuracy and timing of when you get back to patients, because that's the other really important thing. I've had that happen to me too, when a message is just deep in there and it's something like serious, like a heart attack or something, and they're like, is it the econazole cream, for example? And you're like, please go to urgent care. This should have never come to dermatology. And of course, like, it's normal, we all, if we're doing something new and something happens, we can associate it, but don't wait for that kind of response. So I love that you have real-time staff just trained to look for those things and bring them to your attention if needed. So that's a great way to do it. I think you're lucky that you have the staff ratio and trained staff, because that's the other two barriers that we see, is not enough staffing. And then also new staff that you have to retrain, which is some of the work we do around AI as well. That's at least the one stable thing that can carry through, for different teams. So that's messages handled, which is awesome. I think the key is to avoid the situation of just forwarding to the doc, because that doesn't fix anything. You really need to intervene there.
That's just not sustainable. And just to go back, it just doesn't feel good. It leads to burnout. I don't want to do a bad job. Right. And if you are setting yourself up to for an impossible task, you're going to always feel like you're doing a bad job, and you're always behind on your inbox, and you're not getting back to patients on time. And it just creates burnout. You just can't sustain that. And you need to be able to set a system up that doesn't rely on you doing something that you're not going to be able to do.
Right. It's relying on you to have 30 hours in a day, and you also don't sleep.
Yeah.
It doesn't work. It just doesn't work. So you need to have good systems set up. And then the next important part you talked about, notes. Would love to hear about that, because that is another huge area where I think people have tried all sorts of different things, like having the MA maybe come in with them and scribe. They've tried different modalities, and it kind of works to some extent. And what I've heard from a lot is the different modalities can help them get more detail in the note. But I think not many have actually shaved off time yet. like maybe the note is getting better because of these tools, but they're still spending as much time looking over the note and then the ultimate signing the note, at the end of the clinic day, being done with it. What interventions do you recommend there for like actually shaving off time
Yeah,
in that
I
regard?
think those are super pertinent questions and not easy to do. And I think that having your nurses or MAs come into the room with you to help scribe is super key. I think having appropriate templates, especially for like skin exams, Accutane follow-ups, skin exams, excisions, ED&Cs, like a lot of those really are the same note every time. And so really having a strong template for your medical assistant or your nurse to start with when they go in the room, they shouldn't have to change a lot. They're putting in dimensions on ED&Cs and excisions. Most of your skin exams, other than, where you're cryotherapying, where you're biopsying. And then I also think like we are trained during residency, or at least my program, like we were really trained to use the note and the assessment and plan to like prove our knowledge base. And so there was a lot of emphasis put on like these perfect academic notes. And I think you have to let some of that go. And
Right.
I also think that I work as part of a nonprofit hospital group. So part of my job is also like communicating clearly and educating the primary care providers. And so I think that it's really important to have good notes, especially with like complex medical dermatology patients on, you know, making sure they understand our medical decision making, our differential diagnosis, our treatment plans, what to do if someone's not getting better. Like I spend extra time making sure those complex medical cases, like I really do spend some time on the assessment plan on the note, right? I do not spend time on my skin exam notes. I do not spend time making the subjective perfect, right? Like, and I think just really being honest with yourself and being like, if there is a reason to make this note really perfect, go for it. But a lot of dermatology, like the notes need to be accurate for billing. They need to be accurate in the sense of what procedures you did and where you did them. So you know if you've already frozen a spot or if you've already treated a spot. But like the semantics, the grammar, the spelling, like some of that, I've had to just let go.
Yeah, I love it. No, that's a great tip actually in general is like not every visit and not every note deserves the same time. And if you kind of get that down, like you said, you have your ratio down, let's say 30-40% are skin checks in a day. That visit should take a certain amount of time. That note maybe takes 10 to 20 seconds, possibly if it's a good template. And then you're gonna have maybe an hour of, I'm just making up numbers here, but maybe an hour of the rashes that are, you're going to take more time in clinic. They might have some prior aughts. The note is going to take longer. And that's really great advice in general is like, if let's say a visit takes 5 minutes, that's okay. You shouldn't feel like you have to like make that visit longer. That's just the way, but maybe you'll see that patient in 3 months and the visit will take 20 minutes. So
Yeah, exactly.
you're right. Just like take the time buying back when you can get it, right? That's the
100%.
main tip. No, I love it. I think you have so much efficiencies down, and just thank you for talking about through the day because I think it's something we don't do. My practice is similar; it's very high volume, and most of my colleagues are just like this. So I think we don't take time to really analyze it, make sure systems are in place, and then we keep repeating the same mistakes. I think I see that often again too. Whereas if you really sit down and audit your time, throw in a couple of these interventions, you can win back so much time.
100%. And
In a
like,
week.
yeah, when you're seeing 100 plus patients a week, like if you can save, you know, even a minute off of
Yeah.
the documentation time per patient, like you're creating a ton of extra time for yourself. And
Absolutely.
yeah. I also think we haven't even really talked about like AI, but integrating like the AI, ambient scribe for complex medical derm. Like, the nurses and MAs are way better at scribing and teeing up a note for a skin exam or a procedure. But for a super complex medical derm case that you're sitting in there for 20 minutes and asking really detailed subjective history, like the AI scribes are killer for that. Like they remember every detail and um also generating like patient handouts at the end of your visit, right? Um, AI can be super helpful, and I'm excited to see how we're able to implement AI into our practice going forward. You and I talked about this previously, where it's like so many people are looking at AI for how can we solve these complex diagnostic dilemmas, which would be great someday, but like I don't really need as much help with that as I do with like just the workflow to be able to support the volume that we see. Like I'm looking for AI to help just get rid of the busy work that's not fun. The complex medical decision making, talking with colleagues about difficult diagnostic dilemmas, like that's the fun part, right? Um, I'm not as interested right now in help in that sphere. Like I want to spend less time clicking buttons on Epic at the end of the day.
Absolutely. I 100% agree with you. And we talked about this. And this is a lot of the work I spend time on as well, because there's the perfect situation you could possibly set up with nurses and MAs. But the problem is sometimes you don't have that correct ratio, or there's turnover and there's the training period. But then at the end of the day, too, the most perfect team what we do is complex. So sometimes, like in a different field, somebody might ask a question about, okay, my blood pressure is high or cold symptoms, but then somebody could send us a message like, well, my scleroderma is acting up. What do I do here? And so some of our just knowledge base of what our staff needs to know can use AI assistance too. So there's so many places there where I think AI is making a huge difference. So no, I love that you touched on that. That really is where the future is. And of course, at the end, we always ask, since it's the Future of Dermatology podcast, what are you most excited about? And it could be AI that you just touched upon, but what are you most excited about for kind of workflows or anything else in dermatology for the future?
Yeah, I mean, I think just what we were just talking about, which is, you know, being able to spend more time being a doctor and using our knowledge to help patients, spending more time like face to face interacting with our patients and less time clicking buttons on the computer, less time doing prior authorizations, less time on all of this busy work on the back end that is just not, at least for me, fulfilling at all. I love talking to patients. I love making tough diagnoses. Um, that's what I want to spend my time doing. And I'm hoping that we can harness AI to really help us with some of the busy work so we can get back to doing what's the fun part of being a doctor and why we got into this.
I love it. I couldn't agree more, because everything is swung so much to, a place of people are kind of burnt out and there's so much on our plates. And I am really hopeful AI is going to swing it back the other way, where we just have more time for the complexity of the things we like to do. So I couldn't agree with you more. And thank you so much, Dr. Coleman. I know you're taking time literally in the middle of clinic. You're heading back to clinic now to see patients. So thank you for giving some of that time to us today. I really appreciate it. And we've learned so much. And it's just so valuable to talk about our everyday lives, which a lot of us are living, in silence and, having to deal with these giant, patient volumes. So thank you for taking the time.
Well, absolutely. And thanks for talking about it and giving us a venue to discuss it and hopefully make some progress.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.